Good afternoon, everyone. My name is Erica Capel James. I'm a professor of medical anthropology and urban studies at the Massachusetts Institute of Technology. And it is my very great honor to be able to introduce an important topic that is critical to the world today, and that is thinking about the future of Gaza and specifically healthcare in Gaza. We are very fortunate to have three experts who are going to be speaking about their personal experiences and their lived experiences, both as Palestinians and as individuals who have volunteered and spent a tremendous amount of time working in both Israel and Palestine. These issues are important not just because of the current acute phase of conflict, but also because so many countries around the world are struggling with what to do during and after conflict, how to bring people who have suffered tremendously back to health, back to mental health, and to begin rebuilding their lives. I'm familiar with these topics from my own research in Haiti over the past 30 years now, and I see that the cycles of conflict and violence sometimes recur when healing does not take place for individuals, families, and communities. There also needs to be justice. So without further ado, I'd like to introduce Dr. Eman Ansari, who's a personal friend and a physician here in Boston. And she is going to be our moderator for the day. Um, there's not enough that I can say about how wonderful she is as a person, how much she does as a humanitarian, and she's an expert. So with no further ado, let me pass it to you, Iman.
Thank you so much, Erica. Good afternoon, everyone. So Erica asked me to introduce myself and then give you a little bit of a background about me and what got me into medicine. So my name is Eman Al-Khadra, and my husband's last name is Ansari, so I became Eman Ansari. I am a pediatric pulmonologist, intensive care unit physician, and I practice as an emergency medicine physician here in Boston. I am also, as Erica mentioned, very invested in social justice issues and have been working very actively in my children's school, our hospital, our medical school, on elevating issues of social justice, not only for the Palestinians, but in general. After my kids grew a bit older and I was able to travel away, I started going to Palestine on medical missions through an NGO called Palestine Children Relief Fund, PCRF. And after many years of going on missions over there to specifically to the West Bank, I joined the board of directors of PCRF, and I'm currently on their board of directors. My path into medicine is not an unusual path. I used to think whenever I talk about my path to my American friends that maybe because I'm coming from the Middle East, it's different, but I think it is a shared path. I was born and raised in Saudi Arabia to two parents who are Palestinians. My father was born in Safad, a town, city in the north, on the mountain in the Galilee. And my mother was born in Haifa. And in 1948, they were forcibly displaced to Syria. They grew up there and then they got married, moved to Saudi Arabia, where I was born and raised. Very traditional home, very traditional expectation. Education was super important for my parents. They wanted us to have university degree. But for the girl, they preferred that I have like English literature degree or Arabic literature or even science. But the ultimate goal is I'll have the degree, I'll put it in the kitchen, and I'll become the best mother ever. So for me to ask to go to medicine was pretty unusual. My older brother is a cardiologist, and he preceded me in going to medicine. And I thought, the smartest people go to medicine. You get to help people, you get to make a difference. I wanted to make a difference. And I decided to go to medicine. Initially, my father did not approve, and we tried our hardest with aunts and uncles and grandparents to convince my dad. And eventually, my brother told him, she's pretty headstrong, so let her go to medicine. She'll be busy with schoolwork and exams, that she will not have time for trouble. And my father, bought that argument, that rationale, and allowed me to go to medicine, and then forced my two sisters after me to pursue the same path to keep them busy. Finished medical school in Saudi Arabia. Again, I wanted to come to the US to do postgraduate training like my brother. And my father said no, unless I was married. So when my now husband asked to meet me and get to know me, I told him, let's cut to the chase. Do you want to marry me? I'm on a mission. I'm coming to the US. And he said, fine. So we got married and came here. And I've been mostly in Boston ever since. I did residency at Tufts, and then my pulmonary and critical care fellowship were at Children's Hospital. I went to Cincinnati briefly, and then came back to Boston. And from there, like, my work has focused on my clinical work. I have 4 children that I raised here in Newton, in Massachusetts. And over the past 6 years, my humanitarian work became of serious level of importance to me. One thing I will say, as I have 1 more minute before I turn it to our first guest. When I went for the first time to Palestine and Israel, it was a very emotional visit. I've never been there before. I've never had immediate family live there. I don't know what is there. So when I went there, I went just like any American who's visiting that land for the first time. And it was an eye-opener. We'll talk more in our conversations about healthcare over there. But I had a sense of responsibility as a pediatrician, to the children over there, because they could have been me, and they deserve the same healthcare that my children are getting in Boston. And that gave me that, sense of responsibility and commitment that I will do everything I can to elevate the level of healthcare over there, to help people there be treated with the same standard of care we have here in the US. And now I would like to introduce our first guest, my colleague, and if I can call you my friend, Yasmeen, Dr. Abu Fraiha. Dr. Abu Fraiha specializes in internal medicine and is currently completing both a clinical fellowship in critical care, so she will be an intensivist like me, at Beth Israel Deaconess Medical Center in Boston. She's also doing a research fellowship at the Middle East Initiative at the Harvard Kennedy School. She is a Palestinian Bedouin physician who practiced in Israel. She was one of the first respondents at treating incoming victims of October 7th. On that day, she lost many colleagues, friends, neighbors. And in the subsequent weeks and months, she lost also friends in Gaza across the border during Israel's devastating military campaign on Gaza. Throughout this traumatic period in her life, she refused to surrender her sorrow or concern for all innocent victims of violence. Yasmeen, marhaba.
Hello.
Can you tell us about your background and your path into medicine?
Sure. So as you mentioned, I'm a Palestinian citizen of Israel. Many people are not really familiar with this definition. Some call us Israeli Arabs or some other definitions, but actually like 21% of Israeli citizens are actually Palestinians whose heritage is Palestinian. And they were basically not refugees after the Nakba in 1948. So my ancestors stayed in the Naqab, the desert area of Israel, the south part, and we're Palestinian with an Israeli citizenship. And I grew up as a Bedouin girl in Israel, but my parents, in a way similar to your parents, really wanted us to get good education. So I actually grew up in a Jewish town in Israel, which made it easier for me, I guess, to get into medical school, because the education system in Israel is very segregated. So there's like an education system for Arabs and an education system for Jewish people. And because I grew up in a Jewish town, I had the privilege to go into a Jewish Hebrew speaking school. And I always knew that I wanted to go into medicine, first because my mother was diagnosed with breast cancer when I was 14. But also I felt like this is the best way to help people. And especially I always knew I wanted to go back to my own community. The Bedouin community was very much underserved, and help them. And actually, after I went to medical school in Jerusalem, the Hebrew University, and when I graduated, I did my internship and my residency in Soroka Medical Center in Beersheba, which is like the biggest city in the south, and was actually started my social activism and some political activism as well, looking into health disparities and working to promote better healthcare or health equity for Bedouin patients, starting with trying to prevent genetic diseases, but later on I had some projects on diabetes and trying to promote and advocate for better access to healthcare. As many of the Bedouins in this area live in unrecognized villages, so they're like these places that are not recognized by the formal authorities in Israel. So they're not entitled to basic infrastructure like, electricity, running water, shelters, which is one of the things that we had to deal with as of October 7th, 2023. And like 100,000 people are getting direct hits by rockets, but they have nowhere to run because there are no shelters and no clinics, and even like the small amount of clinics that we had there actually shut down after October 7th. So that's how I knew that I wanted always to help those who are most in need, and also that's how I got in a way to my research focus, which is politics of healthcare, or the intersection between healthcare and politics. And I guess we're going to talk a little bit about this later on.
But Yasmeen, you were able to enter Gaza, because my understanding is that Israelis could not enter Gaza.
Correct. For us, it's illegal. So basically what I did, so on October 7th, I was attending in Soroka, so in Beersheba, and I woke up at 6:30 a.m. with like the alarms and the sirens and the sounds of rockets falling, which sadly for me, as someone who grew up in this area, we're used to it. So for me, it was like, okay, another morning of yet again hearing sirens. But then I went to the hospital, and the patients started coming. So the patients from the kibbutzim, the Gaza envelope, the Bedouin villages started coming, and this is when we figured out that this is different from what we know. And I have to say, I was trained in this hospital. It's the busiest emergency room in Israel, and I've never seen it the way I've seen it this day. Hundreds of patients, hundreds of bodies, many people came already, dead on arrival, even kids who were directly hit by rockets. But I have to say, so at some point, like in the afternoon of this day, which was really devastating, I looked around and I saw that the people around me, both patients and physicians, were both Jewish and Arabs, or Jewish Israelis and Palestinians. And I think two things came to my mind when I saw this. So first was, as I said, we're kind of like used to the armed conflicts, or what we call military operations, right? So the one thing that came to my mind is like, okay, now I know how war looks like, and how it looks like on the other side when the Israeli army is bombing Gaza, because it's the separation is so strict that I don't really get to. It is illegal for me to go into Gaza, even though I have friends there, I have family members there, so we don't really know what's going on there. But on October 7th, I felt like I had some idea. And then the second thing that I've thought of is that we keep saying that this is a conflict between, Jews and Arabs, or like Israelis and Palestinians, but honestly, no, this is at this moment in time, I figured that this is a conflict between people who believe that violence is the answer, and we need to, with more violence, we will solve this conflict, and people who are actually believing in saving lives and in humanity. And they dropped everything and came to the hospital that day to save lives. And after that, in the 3 months after that, before I moved to Boston, we opened another unit, and I did a lot of work in the community to help people who were, again, directly hit by rockets. And we did try to go into Gaza. I volunteer with Physicians for Human Rights Israel, and they had mobile clinics in Gaza, but they couldn't. Again, it was illegal for them to go in. But we continued to stay in touch with the hospitals there, and with some hospital directors and physicians. And in the past year since then, we've also fundraised. I was involved with many other organizations, and we fundraised over $3 million to World Central Kitchen to get into, to give it to humanitarian aid to Gaza, and specifically food. And since then, I've been documenting what was happening, specifically attacks on healthcare in Gaza, speaking to friends and colleagues who are working there. And maybe just to give some data, is that, and I don't know how people, like how knowledgeable the general population is about this, but since October 7th, about more than 50% of the hospitals in Gaza are now non-functional. So they had 36 original hospitals, and now only 16 are functional. The last one that actually collapsed was Kamal Adwan in the southern part of Gaza, that was actually evacuated on December 28th. And the director was detained, and still, his location is unknown. Actually, according to the WHO data, in the past year, there was about 1,500 attacks on healthcare facilities and staff in armed conflicts around the world. More than 1,000 of them were against healthcare facilities and staff in Gaza specifically. So this is kind of like, at least for me, it's an obvious case of, it's not either or. It's bad it's even crazy for me that I need to say that it's bad to kill people, right? And it's bad to act in violence, and I've seen it for both sides, in both sides, both in Israel against Israelis, and against Palestinians in Gaza. And I'm so glad that we're having this conversation, because I think more people should know what's going on there, and we should actually think of what we're going to do next.
Thank you, Yasmeen. So to just highlight something that you said, that it for you, it's not Palestinians versus Jews, or Jews versus Palestinians in Israel and Gaza, as much as because Palestinians were killed as well on October 7th. Absolutely. And Palestinians have been killed before and after October 7th. Right. But it's the ideology of violence that has been constant, basically killing. And the scale of the killing, of course, we will talk numbers later on in our conversation, but the scale of killing is also very disproportionate. However, for us as physicians, killing is a killing and a life is a life. And each life matters. Jewish, Palestinian, non-Jewish, non-Palestinian, each life matters. Thank you, Yasmeen. Now I would like to introduce our second guest, and that is Dr. Feroze Sidhwa. Dr. Feroze, you asked me to call you Feroze, so I'm going to call you Feroze. He's a humanitarian surgeon, having worked most extensively in Palestine, but also in Ukraine, Haiti, Zimbabwe, and Burkina Faso. He most recently volunteered at the European Hospital in Khan Younis in Gaza from March 25th until April 8th with the World Health Organization. Dr. Sidhwa has written and spoken extensively about the surgical humanitarian work, the United States' role in the Israeli-Palestinian I'm going to use the word conflict, even though I prefer not to use the word conflict, but this is the summary I have, and the political consequences of medical relief work. He approaches the Israeli-Palestinian issue as a secular American and as a humanitarian. Feroze, welcome. So can you initially tell us about your path to medicine, just because some of our attendees may not be in medicine, and it would be important for them to know, how did you make your way? And from medicine and surgery, how did you make your way to Palestine?
Actually, it's the opposite way around. So my freshman year of college was 2000, and that's when the second Intifada broke out. So I started learning a lot about the Israel-Palestine conflict. Read a lot about it. I've edited some books on the topic at this point, and in learning about it, and then of course the next year, September 11th happened in the U.S., and so that was also a big politicizing time. So these were the Middle East was a big focus of political activity and just everything that was going on in the whole country, and certainly on my college campus at Johns Hopkins. So after, I had gone to med school thinking I would be a doctor just because my dad's a doctor and that was the only profession I knew that existed. But afterwards I thought, well, maybe something else would be better. Again, I was a young guy, didn't really know what I was thinking, but I thought maybe something else. So I said, let me go live near this conflict that I've seen. I couldn't get a volunteering position in the West Bank, but I did find one in Israel. So actually, I lived in Haifa. I think you said your mother's from Haifa, right? But so I lived in Haifa for a year. For people who don't know, Haifa is the only mixed Arab Jewish city in Israel, and there are as you can imagine, the city government is dominated by Jewish Israelis, and there's a lot of kind of deliberate harassment and pinning down of the Arab community there. So I worked with an Arab Jewish cooperative that just tried to solve intercommunal problems in Haifa. I mostly just helped them communicate with their funders at the EU. And this doesn't exist anymore, which tells you how far to the right Israeli society has gone, unfortunately. But yeah, so while I was there, I would tour around in the West Bank on the weekends sometimes, and I actually ended up in Hebron. I'm pretty sure I was at Achlei Hospital. I just can't remember. But I ended up in Hebron, and there was a Physicians for Human Rights Israel delegation there. And one of the guys there took me aside, and an Israeli fellow, Jewish Israeli fellow, and he took me aside and said, Feroze, if you said you want to be a doctor, but look at how these Palestinian doctors live. They don't get any special treatment from anybody. Maybe they have enough to buy a used car from some settler, but they don't get any special privileges. They get beaten senseless at checkpoints just like everybody else. They have to watch their children be beaten up, be arrested, it's their life is just as cruel and vicious as everybody else, but they still come to work and still try to help people. And he said, if you would do that, then be a doctor, but otherwise don't be a doctor. And what he said made an impact on me for sure, because I know I could see it, but I hadn't been able to articulate like what was wrong with this picture. Why aren't these people privileged in any way whatsoever, which you could see clearly. But at the same time, I thought to myself, well, I'm never going to be in that situation. I'm the first world doctor in this scenario, not the third world doctor. So so I also took his presence and his attitude, because like this guy could have sat in his living room and criticized Israeli occupation policy all he wanted and nobody would have cared. But by coming into the territories, he's putting himself at risk, not from the Palestinians, but from his own society. I'm sure he's losing social bonds. He's probably losing money, losing job opportunities, losing academic opportunities, because he's going to be seen as a traitor. His position of, oh, we should go, the position, just to show you how extreme his position is in Israeli society. After October 7th, about 100 Israeli physicians signed a letter calling on the Israeli Defense Forces to destroy hospitals in Gaza. That's pretty wild. That's pretty unusual.
This
So
was mind-boggling. Yeah.
well,
In terms
no,
of
no.
hypocritical.
Well, I wish,
Yeah.
I have to be honest. I wish it was mind-boggling, but I'm sure Yasmeen offline would testify that it is not. But no, and I want to be very clear. Israeli society is not some monolith, right? I mean, it's true that peaceable positions are a minority, a very small minority position. But just so nobody thinks we're being unfair, I wrote a letter to the Biden administration that 98 other American healthcare professionals signed, and in that letter we called for an arms embargo. Well, 282 Israeli physicians have signed a letter endorsing our letter to the Biden administration. They didn't bother sending it to Netanyahu. They just sent it to Biden when he was still in office. Excuse me. Sorry, I'm nursing a cough. Well, that's probably illegal for them to do. It's illegal to call for any that it might be considered treason under Israeli law to call for an arms blockade on Israel. So that's not a small thing. But again, it would be also unfair to pretend that that's some that is a very, very, very small minority of even physicians in Israel. But nevertheless, it's there. But anyway, sorry. So my path to medicine. So then I after living in Israel, I came back. I taught middle school in East Baltimore for a year, and then I went to med school in Texas. And yeah, just that's how that went. So I actually decided to be a doctor in the context of the Israel-Palestine conflict, and that's why I continue to work there. But I've worked in plenty of other places as well. I've worked in Ukraine 3 times since the Russian invasion. That's where I got this shirt, actually. And I've worked in Haiti. I've worked in Burkina Faso. I've worked in southern Zimbabwe. Like I mentioned, I've worked in the West Bank. So, yeah.
Yeah. Thank you. So I've been to the West Bank, as I mentioned, on medical missions repeatedly. And what is most impressive, I felt that the level of the physician training and their skills in medicine was outstanding. Like the physicians in Palestine could come and care for our children here in Boston and be on par with my best colleagues. And not only that, they can do even more. So an orthopedic surgeon can deliver a baby, can evacuate an intracranial bleed. Because of their conditions and their limited resources, they tend to be very, very skilled. But the resources are dire and the number of physicians per population is low. And the healthcare system needs a lot of support to even measure up to our basic standard of care, not even the standard of care of quaternary hospital. How was the level of the healthcare system in Gaza? You haven't been to Gaza before this latest attack on Gaza, right?
No.
So just to put our listeners into in the perspective of Gaza, Gaza Strip is in the south. The population in Gaza, over 70% of them are internally displaced from other parts of Palestine, and they live in refugee camps in Gaza, in addition to the indigenous people of Gaza. It's very population dense. The population there is upward of 2.5 million people. In a neighborhood that is really not that large. And they've been under siege and under repeated military attack for over 17 years right now. This latest escalation is a latest escalation, but it's a chronic status of being under warfare, I would say. I'm going to also mention a quick thing that I think you've heard before. For a lot of people who are involved with the Palestinian humanitarian work, the word conflict tend to be less favored because it gives the impression as if the sides are equal, and they're not. Even the word war, as if like there are two governments with two military, who are like the belligerents and fighting each other, which is not the case. So this population has been under attack for a while. Despite that, they have, as Yasmeen mentioned, many hospitals, a healthcare system that seemed to be working to some extent, and it seemed to be now decimated. But you were there on the ground. Can you share with us, Feroze, what did you see?
Yeah, so just to add a little more context, actually, the
Mhm.
everything so the Gaza has been under siege, literally a military siege for 17 years, like you mentioned, since about 2005 when Hamas won the Palestinian Legislative Council elections. And during that time, the U.S.-Israeli-Egyptian blockade of Gaza has reached truly extreme proportions. There's nothing like it that's ever been done in outside of like medieval siege history. It's really quite cruel. Gaza is a strip of land that is 25 miles long, and it's at its widest, it's 6 miles wide. So it's the length of a marathon and the width of a pretty quick jog. It's not large at all. In it used to be 2.2 million people. Gaza City had a population density higher than that of New York City, and of course, without the height of its buildings, without its municipal services, and the entire strip, even including the completely unpopulatable, uninhabitable parts of it, had the same population density as Boston. So this is a very crowded place. Like you mentioned, also 70% of the strip is refugees from the 1948 and some also from the 1967 wars, but also 50% of the strip is children. That 51% of people were under the age of 18. I think it was 40% are under the age of 15, and 15% of humans in Gaza are under the age of 5. That's extremely unusual. It's a very, very young place. And the siege has had some very unusual characteristics for the modern world. In the 90s, when Gaza and the West Bank were still had some contact between each other, you could still move. Gaza's main export was furniture that people would build, and then mostly would export to the West Bank. There were often 10,000 trucks a day entering and leaving Gaza. And that's when Gaza's population was about half of what it is now. Today, we're talking even I'm talking about before October 7th now. The number of trucks that would enter Gaza was somewhere between 400 and 800 per day, usually about 500, to supply all of the needs of this population. This is also a population that since 2005 has undergone, I can't remember because there's so many, like Yasmeen mentioned, the operations that the Israelis, I shouldn't say the Israelis, that the US and Israel keep carrying out against Gaza. There's been something like 13 or 14 of them. Just to show you how extreme these operations are, just to maybe illustrate one point of how extreme these operations are, every time with all three of the biggest operations, that's Cast Lead in 2008 and 9, Protective Edge in 2014, and now this one called Swords of Iron or some crazy name. With all three of these operations, the Israelis have spent days, literally days, running tracked vehicles, so tanks, bulldozers, whatever they could find, along the eastern and northern edge of the Gaza Strip, because that's the only part that has any agricultural land in it, because it's on the tip of the southern aquifer. It just destroying the soil over and over, just compacting it. And eventually the bulldozer drivers are getting bored and actually carving Stars of David into the land that are visible on satellites. This was just reported in the Washington Post yesterday or the day before, that they've done this for the third time now. So this is the quality and extent of destruction that's been done to Gaza over and over and over again for the past nearly 2 decades, in a population that has almost entirely grown up in those 2 decades, is just absolutely unprecedented in any other part of the world. I honestly, I think in human history. If somebody can provide me a counterexample, I'd love to see it. So you're like, well, I asked you about the healthcare system. Why are you talking about this? Healthcare is the very top of what a society provides to people, in the way I think of it. And you guys are academics, so you can probably correct me, but the healthcare is up here. Food and sewage and sanitation are down here, right? Well, when I was in Gaza, most of the healthcare system had already been destroyed. And that's the way it is now, unfortunately. We often talk about if you look at the WHO and the OCHA, the UN OCHA updates, you'll see that there are 36 hospitals in Gaza. That's not really true. There are 36 buildings that are called hospitals, but most of them don't do acute medical care. There are maternity hospitals. They're important things, don't get me wrong, but they're not actual acute care hospitals. They're maternity hospitals, they're rehabilitation facilities, they're pediatric specialists, things like that. And so
none
really
of them is a tertiary or quaternary hospital like we have in the US.
only Shifa, and even then it just happened to be very large. But you know, it did have a cath lab, it did have a neurointerventional lab, it did have a lot of Shifa did, but Shifa, and I'm glad you brought it up. Shifa was really the only place where you could do advanced tertiary and quaternary care in Gaza, not only because of the physical plant of the building, just for maybe people don't know. Shifa Hospital, Yasmeen, was it in Gaza City or was it? Where was Shifa Hospital?
I think Gaza City.
I think it's in Gaza City. But anyway, Shifa is a 700 something bed hospital. It would actually be the 7th biggest hospital in California. So it's a huge place, especially for a territory that only has 2.2 million people in it. It's just enormous. All of the best physicians, all of the best surgeons, all of the most advanced modalities of care, and the only trauma center were for the entire Gaza Strip were at Shifa Hospital. Shifa was raided 4 times and it's been completely destroyed. There were 3,400 hospital beds in Gaza before October 7th, which was already way, way too low. That was at the level of Yemen and Sudan in terms of the per person hospital beds that were available. When Shifa was destroyed, which the Israelis raided Shifa Hospital 4 times, and the last one ended on March 30th or 31st when I was at a European hospital in the south. And so we actually got a large influx of their staff and their patients and things like that. But when Shifa was finally destroyed, 20% of healthcare beds in Gaza were gone. And all of the advanced modalities of care in Gaza were gone, all of them. Cardiac catheterization, like just anything that you would think of as being in a hospital, gone. That was it. So like the top tier of healthcare was just bulldozed off and it's gone. It's not, and in addition to that, with the destruction of Shifa came the killing and imprisonment of a huge amount of its staff. And these were the staff that were at the top of it. So, the heads of departments, the heads of nursing departments, the physicians that had departments, et cetera, et cetera. And so the large mass of experience that keeps any complex system like a healthcare system going, gone. Most of these people are still in Israeli detention or murdered
or killed.
And I there was a particularly vicious example, and I'm ashamed that I can't remember their names. But there was a woman physician, I believe she was a pediatrician, and her son, I believe, was a general surgeon. They were found bound and machine gunned together at when the raid was over. That's what, it just speaks to what the Israeli attack is. But anyway, so when I was at
and Dr. Hussam Abu Fraiha, for example,
Dr. Hussam Abu Fraiha was at Kamal Adwan, like Yasmeen mentioned. And his example is kind of interesting, actually. Hussam Abu Fraiha is a pediatrician, and Kamal Adwan, from what I understand, was mostly a children's hospital. Kamal Adwan basically doesn't exist anymore. But Hussam Abu Fraiha really built this hospital up himself. He was the one who established the departments, found competent people to lead them. He poured his life into this hospital. The hospital was laid siege to for 3 months by the Israelis. This is after detaining Abu Fraiha at the beginning of, again, I totally agree with you, Eman, that a war is not the right way to describe whatever has happened in the past 15 months. But just for the sake of using some rhetorical device, I'll call it a war. At the beginning of the war, or the attack, Abu Fraiha was detained and he was let go. You can't claim, now they're going around saying he's the Hamas colonel that we've been looking, all sorts of utter nonsense. The guy's just a pediatrician. Abu Fraiha, during this 3-month siege, he refused to leave the hospital. His son was killed during the siege of the hospital. His son was killed. His son is buried in the courtyard of the hospital that he created. He's wounded in his leg. So, and then finally, the Israelis demand that he give himself up before they just destroy the entire place. So he does, because he figured he's hoping that by doing so, at least I think he's hoping by doing so, that he'll spare the hospital the worst of it, even though it didn't. Just with dignity and grace, he walks with an injured leg in his white coat up to an Israeli tank, and they open the door and he gets in, and no one has heard a word from him since. And then his mother has a heart attack the next day or the day after and dies because she just can't handle it anymore. Everybody has a limit. So his example it shows, they're taking the Palestinian intelligentsia, not just in healthcare, but in really every possible field you can think of. They're either driving them out of Gaza or just arresting them and killing them. And then that's just having this multi-generational effect that you can see all the way down the line. And again, in a place that is half children, if you take away the intelligentsia, I mean, what are you leaving there, But anyway, to answer the question you actually asked me, sorry, the healthcare system in Gaza, even when I was there in March, which was a relatively good time, especially where I was in Khan Younis, was an utter disaster. The hospital had about 220 beds, and there were 1,500 people admitted to it. There was another 1,500 people lining the hallways of the hospital who just lived they just lived there, because they were the ones that were lucky enough to think, well, if I go live in the hallways of the hospital, I don't have to live outside. Because all of these people's homes had been destroyed. Most of them were displaced from the north, but others were displaced from Khan Younis itself. The grounds of the hospital was itself a displaced persons camp. We were told 10 to 15,000 people were sheltering there. They were sharing 4 toilets and 1 water spigot, from what I could find. Like, just to give one example of how this is a year ago now, but just to give one example of how incredibly overwhelmed this healthcare system was. I did wound care rounds the first 3 days that I was there, just to establish a wound care service, which was obviously quite necessary given the huge amount of explosive injuries we were seeing. Yeah. And I found about 250 people in the hospital who needed daily operative wound care. So they needed to be taken to the OR, put under general anesthesia, have their wound debrided extensively, packed, whatever. But some kind of operation, not a complex one, like I could teach any teenager to do it in about 30 minutes, but nevertheless, it needs these resources. There are 250 such people. There's 4 ORs at a European hospital. How on earth are you going to provide this service? Well, I innovated, and I started, and I probably shouldn't say this out loud, but I started stealing ketamine from the anesthesia carts and doing this on the floor.
So this is my understanding. Yeah, the medication limitation. So the anesthetics were limited, oxygen was limited, antibiotics became, unavailable. So even if you do the procedure, the risks that come after that, and we're talking about the injuries. So similar to what you mentioned before, Yasmeen, like thinking at this from a public health perspective, and the 3 of us are involved with public health and humanitarian work, the number of people who are dying from, the attacks, the violent attacks is something, and the number of people who are impacted by the starvation, the infectious diseases, the post-operative infections, if they were lucky enough to have a procedure, that all compounds the cost, the human cost of what was happening in Gaza. What are your thoughts, Yasmeen?
Right.
You
so
seem you wanted to add something.
I wanted to give some context to this, because also Feroze mentioned the siege on Gaza that started in 2007. Because I think it's important to know the context. It didn't happen, this war didn't happen in a vacuum. Feroze was right to say, the basic thing is sanitation and sewage system. And actually, back in 2018, the UN already declared Gaza unlivable because of sanitary and conditions. And part of it is because of the siege. So many people don't really know that one of the characteristics of the siege meant that the Israeli army actually controlled all entrances and exits from Gaza Strip, except from Rafah checkpoint, which was controlled by the Egyptians. But since the Egyptians and the Israeli army are cooperating, it was basically the same. And part of it was, part of the restrictions was that anything that can be perceived as that has potential for dual use cannot be entered to Gaza. So dual use means everything that can be possibly used for like building tunnels or bombs or whatever cannot be entered. So what does that mean? So all of like the gases that we use for anesthesia, medications, because they're liquids and that cannot be identified, electricity generators. So all these things, even just, concrete, because you can build you can build tunnels with that. So that I hope explains why most of the hospitals there cannot be tertiary care centers, because you can't even get the supplies, because they're all controlled by the Israeli military. So that's one thing. And then second thing, again, as Feroze mentioned, is the frequency of military operations. So almost once a year, these things happen, and every Gazan physician that I've interviewed says, we know that the first thing that happens, that there are deliberate attacks against healthcare. And one of the things, just as an example, is that during May 2021, there was another operation that lasted, I think, two weeks. It was during COVID. And one of the things that happened, that the only COVID clinic and COVID lab that was used for all of the hospitals and clinics in Gaza was bombed, and the director was killed together with 12 family members, and this impacted the care that Gazans received in the following 6 to 12 months, where they couldn't get COVID tests or vaccines for about 12 months, and it increased the fatality rate significantly. So this all happened before October 7th. So once October 7th happened and the war in Gaza started, they already started from a deficit in a way. And when you think of healthcare, public health, I actually saw it, on the Israeli side, we used to treat like soldiers in the first month who came with these bizarre infections, because they were, using the water from Gaza Strip that are all like polluted and infected. And this is without even speaking about, all the poisonous things that you get in the ground just from the bombing, which is something that we know. It's part of it's natural. It's like we talk about poisonous gases after the fires in LA, for example. So all these things definitely impact public health there. And we now, just since the ceasefire, we now start hearing about more and more bodies that are taken out under the rubble, that we weren't even aware of before the ceasefire. So I think that we'll see the real consequences in the next coming months, when there are actually evacuations of all the debris from the bombings.
My understanding, when I first started traveling on medical missions to the West Bank, was that the deficit in the West Bank was stark, like compared to going to the hospitals in Haifa and the hospitals in Jerusalem, and compared to the US. The hospitals on the Israeli side are comparable to our best hospitals here in the US. And you just go through the border with the challenges of going through the checkpoints, Qalandia and others. Once you cross, it's like crossing into time, as if you are in a movie or in a nightmare. Like, the difference is just stark. And people don't know. Like, when I explain to people, especially when they say, oh, they were living fine, there was peace. There was peace on October 6th and October 5th, etc. It didn't look peaceful to me. And while people look exactly the same, like, I can't tell the difference between someone who is Palestinian Israeli or Jewish Israeli, or Palestinian in the West Bank, or on the other side of the fence. Somehow that distinction is very known in for people who live there, and the lives of those two are not the same. I wonder, how can we explain and transmit that information what you saw on the ground, Feroze, what you know, Yasmeen, and you experience on the ground and from your interviews, how can we elevate the level of knowledge of people who are here who haven't traveled there? And the West Bank is in much better shape than Gaza, but it's not in a good shape at all. So I'm just envisioning something that is more nightmarish at baseline than the West Bank. And right now it's even way worse. How can we make them believe that this is the situation on the ground?
Well, it's unfortunate because nobody likes history, including me, but I think you have to look at it. The history is not complicated in any significant way. You know, just like you mentioned, what was, or you kind of hinted at it, what was Gaza on October 6th? Right. Well, again, we don't have time to go through it in detail, but you're talking about an imprisoned child refugee population subjected to massive bombing attack, like Yasmeen said, almost every year. Two of which have been so severe that they've actually resulted in the landscape of the Gaza Strip being changed, like I mentioned. A place where attacks on healthcare were already completely normal before October 7th. It's true that it's been completely just turned up to 11, but it was totally the norm
It was
before that.
ongoing. Yeah.
Everybody fully understood that. And then I try to emphasize to people what this blockade was. Yasmeen did mention that the Israelis justify things in terms of dual use, but it's actually a lot more sinister than that. And it's not, I don't mean to contradict you, but there's a far more extreme layer to it. And this has been reported on in the American press, totally unimpeachable sources. Anybody who wants to look them up can do so. Yes, exactly, Erica, I completely agree with you. Just said,
Yeah, I
somebody
was
said
about to
something in the
mention that.
chat.
Yeah.
Yeah. So Yasmeen, you can probably correct me about the dates. But I believe it was after operation, or excuse me, after the Hamas election, which you corrected me. Sorry, I thought it was 2005. You said it was 2007, but whenever it was, whenever Hamas won the Palestinian Legislative Council elections in the mid 2000s, the U.S. and Israel immediately imposed a siege on Gaza, and there was a very famous quote from a guy who used to be the special advisor to Ariel Sharon, who was the prime minister at the time. His name was Dov Weissglass. He was an American, I think, at least judging by his accent. In a cabinet discussion, he famously said, "Our new policy is that we're going to put the Palestinians on a diet. They'll get a lot thinner, but they won't die." And the important context of that is that when he said that, apparently the entire Israeli cabinet erupted in laughter. They thought it was the funniest thing they'd ever heard. So that was the policy. That he wasn't joking. And unfortunately, to be fair, a lot of them did die, but that was the policy. So the Israeli government went to the meticulous degree, and people should think about what this means. It went to the meticulous degree of calculating how many calories does a Gazan person need to survive, and then allowing specifically that many calories into Gaza every single day. Why on earth does Israel have the power to do that to an entire population? Just imagine if that's how you lived, would you accept that for your children? Would you? Nobody would. This is outrageous. No one on earth would accept this. I mean, Jews in the Warsaw Ghetto didn't accept it. Why would they? It's outrageous. It's totally outlandish. Palestinians in the Gaza Ghetto weren't going to accept it either. And the cruelty of this policy just escalated and escalated and escalated and escalated and escalated. And incidentally, just people can challenge me if they think I'm wrong, it tended to escalate when Hamas became more reasonable, not when they became more violent. That actually went the other way when they became more violent. So there's a long history there for sure, and it's quite extreme.
Yeah, and I will say, I just want to add that the two arguments that we hear. So one argument that we hear recently is that, we've tried a Palestinian state. It was Gaza. Look what happened. So I think that what Feroze is mentioning is just a good example that if you don't really have control on transfer of like food, medication, just freedom of movement, then you obviously don't have sovereignty. So that's definitely not an example of like a Palestinian state that failed. That one thing. And then the second thing that I will say, especially about the attacks on healthcare, is that one of the arguments that we hear is that, it is justified because there were hostages hidden there. So on a personal note, I have to say I have friends who were hostages and were murdered, and colleagues who were murdered. On the, let's say, the Israeli side, I hate to do this division, and I still don't think it is justified to attack a hospital because of that. Just imagine that, I work now at Beth Israel, as you mentioned. Imagine that, I don't know, a terrorist organization is having a hostage situation in the hospital. No one would even think of bombing with a bomb of like 1 ton of explosives, bombing the hospital. It would be unacceptable to anyone. But I don't understand why in Gaza it is acceptable and it is justified. I think it should be an unacceptable argument. And as as a medical community, as an academic community, as a human community, we should definitely condemn this and make sure that this does not happen again.
Yasmeen, I'm sorry about your friends that you lost and the family members and people from the South. So I think, yes, it goes without saying, but I'm going to say it. Every life matters. Like, this is our oath as physicians. Every life matters. I mourn the Jewish life that was lost, but I mourn the Palestinian life equally. The issue I think we've been encountering over the past 16 months is that somehow the Palestinian life is discounted. And it's worth dispensing with 40,000 or more of Palestinian lives because of what happened.
Sorry, out of the last count, 61,000.
61,000. I think the count is more. I think right now, during this semi-ceasefire, and once the UN and other humanitarian organization can do more work, I think the numbers will be different. So I'm at Harvard, and the late Paul Farmer used to say, the idea that some lives matter less is the root of all that is wrong with the world. And I think one of the challenges for me as a physician and as a Palestinian is that specific thing. Like, Palestinian lives should matter. Jewish life does matter, and Palestinian life should matter. And that is part of what is missing from a lot of the reporting that comes out. We're mentioned in numbers like 61,000 versus, the names of the people. Each one was a life of its own, which is really part of the dehumanization that's happening to the Palestinian in our Western media. One thing I want to ask you, Yasmeen, you're an Israeli, a Palestinian Israeli. I prefer the term a Palestinian Israeli than Arab Israeli because we're a very specific population. Like, we don't say, Latino American, like we say, someone from Puerto Rico, someone from Cuba. So you are a Palestinian Israeli. How has it been for you over the past year, speaking up for the humanity of Palestinians in Gaza, as an Israeli, knowing that some of your colleagues back home have lost jobs over this?
Yeah, it is extremely challenging, more challenging than I would have thought, because I expect at least my colleagues, like the medical and healthcare community, to understand that every life is sacred, as you just said. And I was disappointed and surprised to learn that it wasn't as obvious as it is to me. And yes, many of my colleagues who said that actually lost their jobs. I still think that at this moment in time, it is our obligation to say that and speak out about the sacred, the fact that every human life is sacred, and that we must stop all violence, and we must, as you said, advocate for Palestinian lives, and that they do matter just as much as any other lives, and I have to say, like, I do want to end on a hopeful note that there are some Jewish colleagues, Jewish Israeli colleagues, many of them, who share our values and also speak out against this. And especially, I have to say, in the past day, after like the President Trump talked about, you know, another forced displacement of the 2 million Gazans to other countries, and that maybe the United States will own the Gaza Strip. Many speak against it and plan the resistance. This is our time. We have to resist this. So even though it is challenging, and even though it demands a lot of courage, I still think that as a Palestinian, as an Israeli citizen, but as the citizen of the world, the human being, it is my obligation to resist what is happening now and do whatever I can to actually promote peace and shared humanity and society in the region.
Thank you so much, Yasmeen. And thank you, Feroze. And this is an excellent point to now from it to start taking some questions from the audience. So one of the questions that came is asking about housing. Given the area size of Gaza, could there be or are there immediate efforts to engage housing systems that could nurture health efforts and food security? They mentioned so many technologies and or designs that allow for off-the-grid alternative dwelling, energy, gardening efforts. These are all necessary for health and wellness. I agree with you, Ryan. What do you think, Feroze and Yasmeen?
So obviously, I mean, housing is as we mentioned, it's like one of the most basic things that we're now facing when we even just discussing reconstruction and rebuilding of Gaza. I think so. My rule of thumb, at least, you know, thinking of the future, is that anyone who can fund a bomb or like an airplane who bombs people can fund clinics and housing and you know, rebuilding sewage systems and stuff like that. So
not at the same time, right?
I mean,
that is, I have to say, one of the
yeah. I mean, it shouldn't be at the same time. You shouldn't fund bombs,
which is what we have done. What we have done as Americans. Like, we sent humanitarian aid, and at the same time, we kept sending the bombs, and that is just hypocritical.
Absolutely, absolutely. But if you have the nerve to pay for bombs, at least have the decency to pay for, you know, housing and clinics and hospitals and education. And that's what I expect from the global community, from us as, you know, as just, you know, humans. And yes, we are so good at developing technologies to kill other people. Everyone is talking about AI today. We also there were a few like publications about how AI was used actually to kill people in Gaza and Lebanon and the West Bank in the past 15 months. We should leverage these technologies for better public health and better education, and to actually rebuild Gaza from a place of trust, and invest there as a, you know, as a global community. That's how I see it.
Thank you, Yasmeen. Feroze, you mentioned human rights at one point. I will say that this past December, on the 10th, marked 76 years since the adoption of the Universal Declaration of Human Rights. And you're right, security and shelter precede water, and water precede food, and food precedes health. But health is one of them. So one of the questions comes asking, what are the sectors you think are most needed right now in healthcare after we establish the immediate need of security, shelter, food, and water?
Honestly, I would say, you know, trauma care, but then also obstetric and pediatric care, I think would be probably the most important things to focus on. Yeah.
Yasmeen, what do you think?
I mean, I think I agree with Feroze, and he has more experience in this than me because he was there. But at least from what I've heard from other physicians, it seems like everything is in, severe shortage. So all the basic needs, primary care, pediatricians, obstetricians. We don't talk about mental health because this is in a way maybe higher on the Maslow pyramid, but
yeah, it's like a luxury. Yeah.
Yes, but no, it's not. It's not luxury. We need to remember that on average, a person in Gaza lost about 30 family members. What does that do to your soul?
Mental health.
Yeah. Right. And everyone is traumatized. Everyone is traumatized everywhere, right? But we have to keep that in mind as well.
Thank you. Thank you, Yasmeen. And Feroze. Zareen is asking, and it's great to see you here, Zareen. She's asking that if she cannot physically go on medical mission as a physician here in the US, how can she support the healthcare sector in Gaza and the West Bank? Mental health would be one way, right? Like if we can get electricity up and running, and have internet, could we have mental health appointments with physicians here?
Yeah, I think so. First, I know of like a specific venture. It's in the West Bank, but it's like digital way to deliver mental health treatments in Arabic or in English. I want to say like the Palestinians, both in the West Bank and in Gaza, and that's evidence-based, are the most educated out of the Arab world. Most of them know English, so this can definitely help. I also want to say, I think that's a good opportunity to speak about what happened. I think it was last week where 2 Palestinian patients were supposed to speak, I think at Harvard, and I feel comfortable saying it as Harvard faculty, and it was canceled. So I think that's another thing that we can do as as physicians here. There are Palestinians here from Gaza who left, ran away from the bombs, looking for better lives, and many of them are sick or patients, and they can be supported here as well. And we just need to let them speak about their experiences and not cancel them just because it's, I don't know, unbalanced.
Thank you, Yasmeen. I can speak actually a bit to that experience. So I'm the organizer of that lecture at the medical school, and complaints came over the weekend about the event from people who I feel, out of empathy, I would say the word Palestinian patients from Gaza is a trigger for them without understanding how the event will happen. So it wasn't canceled as much as it was paused to explore what it is and to have all the facts. So once the dean had all the facts, he's actually approved reinstating the patient sessions, the Gaza patient sessions, and the lectures. Okay. So it's actually a success story in which reason and common sense and speaking directly to people who are making decisions and making the argument works.
So there you go. That's a wonderful way of what we
yeah.
And I think there were also about 200 discrimination complaints filed about this, right? Like there were hundreds of complaints filed. At least that's what the Boston papers reported this morning.
Boston Globe said. Feroze, just because I know the inside of that story, the lectures were approved before the knowledge about the complaints.
Good.
I think there
That's
is,
great.
and one of the questioners brought up the issue of pervasive anti-Palestinian racism in the US. That is a true statement. We do have pervasive anti-Palestinian racism, and we do have censorship and silencing. It's not happening in this instance because they were approved to be reinstated. However, Permission to Narrate was an article that Edward Said wrote decades ago. And I think I agree wholeheartedly with you, Yasmeen, and with Feroze. We need to speak up. We need to shed light on the facts on the ground. And we need to elevate the humanity of Palestinians. Palestinians are humans. And they deserve equal attention, equal humanity, equal right, just like any other people. Not more, but not less, definitely not less. One of the questions that also came is, where would people find accurate resources to learn about the situation on the ground from a medical standpoint? Do you think the
the health
UN,
clusters? Yeah, the UN, the WHO health clusters. There's plenty of resources online from people on the ground.
I will just say, because I don't know,
Please.
Feroze will probably not say, but he has a wonderful piece in the New York Times that gives some testaments from physicians who worked in Gaza, and it really is a painful read, but I think it's very, very important.
Thank you. Thank you for writing it, Feroze.
No, happy to.
Yeah. One of the questions that also came is, as US citizens, how can we advocate for Palestinians and what's happening in Gaza? So people who are not in healthcare.
Yeah, I mean, I think people in or out of healthcare should just recognize I try to emphasize it all the time. There was no Israeli attack on Gaza. There was a U.S. Israeli attack on Gaza that's been going on for the past, like we said, 17 years. Everything the U.S. and Israel Israel has been described, I think, accurately as an offshore, as a stationary American aircraft carrier in the Middle East. There's a lot of cooperation. That the two military systems are very, very tightly coordinated. So you just have to recognize that we are the ones that committed these crimes. That's it. As soon as you recognize that, it's pretty obvious what you should be doing. You should be trying to stop them. How you don't, like, if you go set your neighbor's house on fire, you can't walk back to your house and say, yeah, I don't really care what happens when my neighbor's house catches fire. It's like, no, you're the one that set it on fire. If you commit a crime, you're responsible for the consequences of that crime and mitigating them and paying people reparations for them, et cetera, et cetera. It's not complicated how that has to happen, but that requires political organization. It requires talking to people, and it requires taking some risks.
Talking to our politicians, voting the right politicians, and that look at humans as humans. Absolutely.
Or creating new political systems, whatever it might be. I don't know. That's up to everybody else to decide. I couldn't claim expertise in that, but yeah.
Thank you. That question comes back to you, Yasmeen. Michal is asking, what do you think Israeli, Jewish, and Palestinian physicians can do to make a difference?
That's a wonderful question, and I love it, because I think we always have a choice. We can choose to sign a petition or a letter that says it's okay to bomb a hospital, or we can choose to actually cooperate with our colleagues, Palestinians and Israelis. And I have to say, actually, in the past 2 years, I was working with 2 other colleagues, researchers, on a qualitative research, and we studied healthcare initiatives that are joint Israeli and Palestinians, cross-border or cross-cultural. Some of them were, Israelis and Palestinians from Gaza, some in East Jerusalem, some in West Bank, and some inside Israel. And we actually showed that we looked at 3 metrics: so equality and participation and management and decision-making, intensity, how intense the interaction is, and intentionality, how intentional the programming is in terms of building trust and speaking about the traumas, the narratives, the pain, and stuff like that. And we showed that all these 3 are associated with building trust. And I think that healthcare, the reason we chose healthcare and health and medicine in general is because this is kind of like in a way a profession in consensus, in which we actually see on a daily basis Israelis and Palestinians interact and collaborate, because of the Hippocratic Oath, and because we really the consensus is that we're here to save lives, no matter who our patients are. And this is a profession that is based on trust. We are trained on how to deliver, difficult conversations, and we're trained on how to build rapport with our patients. And we see that, so I see that on a daily basis, that a Palestinian can treat Jewish patients and vice versa, and they trust each other. So I do think that or at least I expect my Israeli Jewish colleagues to first understand the power dynamics and how, and their privilege, and actually leverage it to support their Palestinian colleagues, create more cross-border collaborations in, training healthcare staff, delivering more equipment and medication, advocate for Palestinian physicians and specifically Palestinian patients, and advocate for a better access to healthcare. This way we can actually build bridges toward hopefully some kind of a solution that can scale up beyond healthcare. And I really believe that this has a great potential.
I fully agree. Thank you so much, Yasmeen. Thank you. So Ryan here brings another comment. He's saying just talking about this, speaking for the past hour and 17 minutes, has been cathartic and therapeutic exercise. Are there any international Zoom groups to connect victims of war in Gaza to people who want to listen to them, who can just talk, like the traditional pen pal concept, a weekly or monthly effort to share hope, pain, dreams, etc.? I know a lot of us have been glued, glued to the Instagram and Facebook, and we follow stories and follow journalists from the ground. But tell me, Feroze.
No, I was going to say there probably are, but I don't honestly know where they are or how to find them. But yeah.
Yeah, so I don't know necessarily of Zoom groups.
Yeah.
But there are definitely people posting stuff on social media. There is a great podcast called Unapologetic, the third narrative, that is done by two Palestinian citizens of Israel. One is from East Jerusalem, actually, so not Gazans. But there are Palestinian communities in US cities. Eman maybe also can speak about this, but we have some Palestinian community here in Boston that has events, and there are events in different universities. I think maybe just getting more into these circles will get you exposed, I guess, to Palestinian stories.
Yeah, there is in Boston, and I think in many cities, the annual film festival, and that was actually an entry for me to learn about the Palestinian community in Boston when I first came in, and I got to know a lot of people through the film festival. And we end up building actually communities locally in Newton, in Boston, of people who would like to discuss the Palestinian issue. One suggestion I will have: I'm a book lover and a voracious reader. You can start a book club and read different books about Palestine, and educate yourself and the community around you, and that will keep the conversation going. I would say the book we reviewed most recently is a book I would highly recommend. It's a 2024 Pulitzer Prize winner by Nathan Thrall. It's titled A Day in the Life of Abid Salama. And the book is about a school bus that end up getting set on fire by hitting another trailer. And 6 people end up dying of burns. And it talks about all these circles, structural circles that contributed to eventually the death of the 4 kids. You could say the fault was the driver of the trailer, but it turns out that the fault is a whole structure that made that road, that made access to healthcare harder, that made the access of the parents to their kids in these hospitals harder. And it talks about the bigger picture of occupation, which actually gets into, we're all involved in public health, the public health parable. A couple of years ago, I think there was a post about physicians needing to stay in their lane and stop talking about gun violence. But it is our lane. We don't want to be in politics, but we are physicians. And the parable in public health is if you're seeing someone dying and you resuscitate them drowning in a river, and you resuscitate the first, the second, the third, at one point you need to go upstream and see what's causing all these drowning incidents. You'll find a broken bridge and you need to fix the bridge. And I think it's part of our Hippocratic oath to look upstream while treating the patients and figure out how to basically fix the bridge. Excellent. I'm wondering if there are any other questions. One of the questions that someone posted, it's a bit provocative, but I think it's worthwhile. I accept that question. It says, why should a US citizen care about Gaza or its healthcare? In the same vein, I would say, I've heard it from so many people, there are so many wars in the world. Why should we only single out Gaza?
I don't think we should only single out Gaza, but it's exactly what I said before. You should care because you're the one that smashed it. I can't walk into my neighbor's
typically my
house.
response.
I can't walk into my neighbor's house and set it on fire and say, ha, I don't care what happens in my neighbor's house. If you want to say you don't care about what happens in other countries, we have our own problems to deal with, that's completely fine. That's a totally legitimate thing. But then you don't get to go drop bombs on other people and at the same time say that you don't care about what happens to them. Like no one, that's it. Like, imagine if a Russian said, I don't care what happens in Ukraine. We don't, it's so obvious that that's an idiotic statement, because Russia is the reason things are happening in Ukraine. We're the reason things are happening in Gaza. We are the reason that Shifa Hospital is not a functional place anymore. We're the reason there's no road system. We're the reason there's no sewage system. We're the reason that the population of Gaza might now be 500,000 less than it was 2 years ago. You don't get to just say you don't care. That's not that. When you commit crimes, you're responsible for them. That's a basic moral precept that literally nobody has had a hard time understanding. And that's why so much effort is taken to trying to pretend that this is a conflict going on between two other people over there, and that we're just this silent observer. That's not the situation at all.
And I'll just add that, the taxpayer in the US funded this war much more than I did as an Israeli taxpayer. So this is why if you care for like what your tax money is doing, then you should care about this.
Absolutely. And I would say, as a pediatrician, to just think, as you both said, like more than 50% of the population are children. It's just horrifying to think what they've endured and how many of them have been killed and maimed. It's just unfathomable. I love quotes. So I'm going to say James Baldwin's quote, "The children are always ours, every single one of them, all over the globe. And I'm beginning to suspect that whoever is incapable of recognizing this may be incapable of morality." I want to give Erica a chance to share with us some of what they are doing at MIT. Erica,
Yes.
Please.
First of all, thank you, Eman, Yasmeen, and Feroze for such provocative, moving, and personal discussion today. I truly appreciate it and hope that future viewers will be able to benefit from your experience and your knowledge and expertise going forward. Some of the themes I think that stood out for me, and again, I come from doing most of my professional research in Haiti, which is a country that has been embattled for different kinds of reasons, but that has also suffered with multi-generational endurance of political conflict, poverty, violence of many kinds, and the long-term psychosocial aftermath. So I've thought about, several questions in your conversation. You were thinking about how do we rank and decide what is the best way to assist or intervene in the post quote, whatever the so-called post era will be, whether there's a period of peace, whether it endures. So that's one theme that I think we're thinking about. You know, is it basic needs first before mental health, or is it infrastructure? And my experience from Haiti in working on the post-conflict period there is it kind of has to be all of them at the same time, but still there may not be successes. One thing that in my research has shown is that the survivors of politically motivated violence without a future, whether it was education, employment, etc., became the later gang members who are, you know, now in many ways destabilizing Haiti. You know, so I'm hopeful that that there will be, you know, a sovereign entity that can make decisions for itself. Yeah, Yasmeen's points about there needing to be kind of expertise on the ground that sort of leads the way, but then also collaborations with community members across borders, across disciplines. I think that's also critical. We also talked a lot about, especially Feroze, the question of our complicity, meaning Americans' complicity with types of political action, the militarism and intervention overseas, as well as our own responsibility. And I think that's something I would love in the future to take on to greater degree, is how do we understand what responsibility we each bear individually, and then expand out, and then to think more about then what does the level of our own responsibility mean in terms of how much we should engage to try to help repair or to bring about justice, you know, for crimes or for harms, however you want to speak of it. We talked a lot today too about the question of the value of life and how it has become normative to devalue certain populations' lives in the world, and especially Gazans, and the extent to which we spoke about the calculation of, you know, not only nutritional values, but, you know, the categorization of whether something has a single use or a dual use. And, you know, this type of mentality or this type of ideology, I find, I wonder, how does one, these are questions for the future, but how do you move from sort of this precautionary position and always anticipating the worst, and so such that humanitarian aid is viewed as, you know, potentially a source of future resistance or protests on the part of, you know, Gazans or whoever. I mean, that I think is a broader philosophical question. I did want to also just to point out to our viewers that the MIT Libraries is going to be hosting this webinar. We are going to be putting up full bios of all of our speakers and participants. We will also have suggestions for those of you who want to, you know, either get involved locally or, you know, to support some of the international organizations and institutions that we mentioned today. We will put all of that information, and we will put links to the article that Feroze has written with a colleague, and other resources to help you as you begin to learn. I took very seriously as well the question of all of us individuals who are asking, what can we do? Start locally, building relations, learning about others, and maybe ask, how can I be of help? Maybe not, we should assume that we know or never we are the experts, but to hopefully with humility and a stance of desire to be a true ally, you know, reach out in that vein. So I am supposed to be doing the closing. I want to thank you all again. I didn't know
Thank you.
anyone has any last thoughts really quick.
Thank you for elevating our voices, Erica and MIT. I'm very grateful for this opportunity.
Thank you. I'd be remiss if I did not say, at MIT later this month, you can reach out to me, Erica James, ejames@mit.edu. We were going to be hosting a virtual reality exhibit called The Phoenix of Gaza. And
Mhm.
it's going to be limited in terms of how much access, but the exhibit is moving from MIT, then it's going to go to UMass Amherst, and it shows images before, during, and after October 7th. But a lot of it is about seeing what doesn't exist any longer, unfortunately. One of my colleagues, Dr. Devin Atala at UMass Boston, says that all of us who are hearing these stories and trying to be open are ourselves embodied archives. And right now, with Gaza being virtually destroyed, we, I think, have a responsibility to keep alive the history, the memories, and to the extent that we can. Second event happening at MIT and the Department of Urban Studies and Planning, there's going to be a 2-day symposium to talk about the role of urban planning in the Israeli and Palestinian, and specifically Gazan everyday realities. I don't know that that is going to be open to the public, but they will be putting some things online in the future. I like the idea. I volunteer myself. And thank you. Thank you all once again.
Thank you for having us.
Bye.
Take care.